I opened the Migraine and Spine Clinic a couple of years ago to fill a need. First, the need was seen when my own wife is a chronic migraine sufferer, and I experienced on the personal side what it's like to go to the ER, wait 4 to 6 hours because they don't prioritize you, to be taken back and not treated with the utmost respect because there's no test to prove you're actually having a migraine. And unfortunately, a lot of people use that as a way to get pain medicine. And in this environment that we're in today with the opioid crisis, that becomes a problem for true sufferers, getting treated as if they're not truly suffering, that they're actually just there for opioid medication. Later on, I got into neurology and became an expert in migraines, and patient after patient would come in and talk about over the weekend how they had to go to the ER because they had a severe attack, and they would say almost the exact same story I've experienced personally with my own wife. And an idea formed that there's got to just be a better way. Although migraines were the original reason for opening the clinic, working in neurology, we deal with a lot of neck and back pain from pinched nerves. And I found that those patients were also treated very similar as migraine patients at the ER. The ER doesn't want to deal with neck and back pain. They don't consider pain an emergency. So they typically don't do much for those patients and just refer them back to their treating doctors. But that doesn't help them for acute flare-ups that are causing severe discomfort and disability. So we decided to incorporate neck and back pain with the clinic. They are made to wait long hours, and for a migraine sufferer, the ER lobby is maybe one of the worst environments to spend 4 to 6 hours while you're in the middle of an attack. The bright fluorescent lights, the loud noises, those are things that irritate the migraine sufferer. The migraine clinic serves as an option or an alternative to the ER. What we do is we bring you into a friendly environment for migraineurs, soft lighting, cool temperatures, reclining chairs, comfortable environment while you wait for a provider to come and assess you and ultimately treat the active migraine. We do this through nerve blocks, which are very safe. They're very effective. Our success rate is in the 98% range, and most patients are able to return to work or back to whatever activity they were doing before they came in. It's a very safe procedure, very effective procedure, and best of all, we don't have to use opioids to knock out this pain. We use nerve blocks, we use steroids, we use FDA-approved cocktails that they use in the ERs. We just don't make you wait 4 to 6 hours before being seen. From a cost perspective, for the patient, it's a much lower cost coming to an urgent care clinic than going to the ER. Insurances deal with urgent care clinics a lot easier than they do the ER. At the Migraine and Spine Clinic, we take a holistic approach to treating our patients. We really paid a lot of attention to our environment, lights being low, quiet, nice, cool environments. These are all friendly environments to an active migraine sufferer. Our treatments are quick acting. 5 to 8 minutes after the initial injection, patients start to feel relief. By the time they're leaving 20 minutes or so after the initial treatment, patients a lot of times are down to a 0 out of 10 pain. They're able to return back to their life, whether that be going back to work that day, going to pick up their kids, being a mom, being a dad, whatever it is that they're doing that the migraine is taking them away from, we're able to give that back to them pretty immediately.